Let's talk about patient management. Under patient management, we have patients. This is the entry point for all the patients in the system. This is where you see the list of patients in the database. Now, over here, you can use the search button to search for any patient, or use the advanced search button to enter either their first name, last name, date of birth. You can also search for patients based on Hishemu or companies. A patient can be assigned to an individual care team member, a group care team, or a department care team. Whoever a patient is assigned to, they can get to assess the patient's clinical record. This means that a patient's clinical record can only be assessed either by those who are consulting for the patient or those who are assigned to the patient. To add a new patient, you click on the plus button. The fields that are marked with asterisks are compulsory. For the first name, James, and then surname, Morris. Age, 29. This is for the patient's phone number. The National Health Service number. This is a unique code generated by the system for every patient. If a patient is registered in another hospital that is using this system, you can add their unique code here, else you leave it blank. Type in the title, middle name, the previous surname, the patient email, patient ID. You can add multiple IDs of a patient using the Add button. For example, hospital card, PVC. After that, you click on Next. Now from here, you can confirm that the patient is not already on the system, and then you can fill in other details like the patient passport photograph. You can add the personal details of the patient. You can add the contact details over here. You can add the insurance details, if the patient has any registered insurance. Then you can add other details. For example, payment options. If this patient is part of a family account, you can select it here. And select the account holder. Note that the account holder must be registered first to be able to use the family account. Then, subscription. Different subscriptions here cover different fees in the hospital. Then you can fill in other details as you see fit and you submit. I'll cancel this for now. The next is the outpatient department. Under the outpatient department, we have appointments. We've already discussed appointments under scheduling. Just like the front desk, when a patient comes into the hospital without any prior appointment, you can book an appointment for the patient here. You can only select clinics that are running that day during the appointment setup. Over here, you can register a patient visit. From here, you can select the clinic. Let's say Family Clinic. And then you can add a new visit. From here, select the appointment type. Let's say New Appointment. Then search for the patient. This is for the online consultation. Select the specialist or the consultant over here. Then you select the patient billing option. Now this patient has a family account, so it can either be billed from the family account or from the private account. Then you specify if this is the first visit or a subsequent visit. Decide who the patient is going to see, either the doctor or the nurse. Then from here, we have the bill items. These are additional items that the patient wishes to pay for. The patient can pay for their subscription, or daily feeding for those who are admitted, and several other things. And then the amount. Then you can add. I'll cancel this for now. Next, we have the inquiries. This is simply an option for searching and viewing information related to patient visits. Then we have the doctor's workbench. This is where the doctors go to see the appointments they have for the day. We can select a clinic. And if there is any appointment, it will show up here. You can also use this to select a specific date. Just like the doctor's workbench, we also have the nurse's workbench. The nurses can come here to see the appointment that they have for the day, or a specific date. If there are any appointments for nurses, they can be seen here, but the clinical record of the patient can only be modified if you are consulting or the patient is assigned to you. Under the inpatient, let's start from the ward management. In ward management, we have buildings. This is where you specify different buildings that are owned by the hospital and used for patient admission. You can add a new building from here. Define the building name, and then we add. Next, we have wards. These are different wards that are available. You can filter them by selecting a particular building. These 2 wards are in the main building. The building we just created has no ward, so we can add a new ward. From here, we can call this Charity Ward. Then here you can define the facilities in this ward. For example, AC, fridge, etc. Define the bed capacity, let's say 10. And here is the department that manages this ward. Let's say the internal medicine. These are the charges. You can put the item name, the code, the item amount, the type. The item will be charged weekly or daily. The GL code. If there is any discount, and then you can use this button to add multiple charges. Then you can add. Now, under Building 2, we have Charity Ward. Let's select all buildings. Next, under the Inpatient Ward Management, we have beds. Here, you can select a particular ward to see the beds that are available. In the King's Ward, we have 5 beds. In the Queen's Ward, we also have 5 beds. Then we have the Charity Ward, which we just created. Let's add a bed. Let's call this Bed 1. On the regular. Then the Charity Ward. Not damaged. Then we add. Now we have 1 bed under the Charity Ward. You can also select a bed and edit. If this bird is damaged, you can edit to mark it damaged, or you can delete. Next, we have the bed categories. Currently, we only have the regular bed category. You can add more categories of bed from here with different rates. Next, under the inpatient, we have the medicine administration. Here you can see all the admitted patients that their medicine administration is due. This can also be filtered by dates, so if there is any patient that is awaiting medication, you can see them here. We have the patients on admissions. Here you can see all the patients on admission. You can filter these by selecting the building and the ward. When you select the patient, you can view their clinical records. If the patient is assigned to you, or you are consulting, you can also open the case notes. You can see the nurse's notes, and every other information related to this patient. You can also use this button here to transfer this patient, use this button to discharge, and this to view the details about the patient. In the details of this patient, you can see the gender, the date this patient was admitted, the diagnosis, admitted by, and the date of discharge. Next, we have the Admit and View Bed Availability. From here, you can see the available beds. You can also filter them by building and by the ward. And then you can add a new admission to this bed. You can type in the patient's name. You can add the diagnosis. You can select the building, the ward, the bed number. This is the staff admitting, the estimated discharge date, and then you can assign this patient to a staff, a group, a department, or based on position. So they get notification, and then you save. I'll cancel this for now. We have birth registration. From here, you can register new birth. Click on the Add New button. Type in the date of delivery, the time of delivery, the patient, the type of delivery, and every other information related to new birth. You can also add notes with respect to the birth, and then you can add, "I'll cancel this." Under the inpatient, we have inquiries. You can use this to make inquiries with respect to inpatient information regarding historical data. Then we have the price listing. Under the price listing, you can define the price for feeding and bed for different HMOs for each of the ward. You can edit the price listing with this button. We also have scheduled medication. From here, you can find a patient, and then you can schedule a medication for this patient. You can select different medications, the start dates, the intervals in hours, and how many occurrences. So when this medication is scheduled for this patient, it will show up under the medication administration.